Hello, how's it going, Miss Melissa? My name's Clark Wilkey. I'm Chief Resident at the Family Medicine Community Memorial Hospital Residency. I did an audition rotation my 4th year of medical school and spent 4 weeks here and just fell in love. I fell in love with the program. I couldn't believe how wonderful the residents were, and the attendings are, like I said, I can go off on how much I've learned from the attendings and how much they have helped me grow as a physician. So this is Dr. Mick, and I've learned so much from her.
I really enjoy working with family medicine residents a lot, and hope that shows. It's a young crowd. They always challenge you, so we always have to be up to date. We always challenge them as well, so it's a mutual relationship, and it's beneficial to both parties. I would say it's really rewarding to see them grow and to see how they transform from the newly coming, new interns to graduating physicians.
Really, Dr. Mick and the other attendings know us so well that it actually gets really specific. So I had an example the other day. I was on the phone and I was calling the pharmacy, and I was still kind of like, oh, this is Clark Wilkey, family medicine resident, and I was kind of like, I was kind of beneath who I am, I guess, or I wasn't like saying, I'm Dr. Wilkey, this is my patient. And Dr. Mick recognized that, and we had a conversation, and it helped me a ton. And since then, I've been a lot more assertive. I've been a lot more kind of what you just described, like saying, this is my patient, and I am a physician, and this is what I need. And that was great counsel. So I think the thing that surprised me the most about this medical journey that I've been on is the more I learn and the harder I work and the more I get to know, the harder I work for my patients, the happier I am. Yeah, this morning's been good. I've seen about 4 or 5 patients. I've had help by our wonderful med students here. The beautiful thing about family medicine is it's so diverse, so broad spectrum. And at this time, I'm pretty interested in doing outpatient medicine, focusing on preventative care, and that's just kind of the basic of family medicine, and that's what I love to do. Focusing on things like diabetes, hypertension, nutrition, exercise, and then all the chronic illnesses that come along with preventative care and things that we can hopefully prevent in our community. Yeah, it's hard. Residency is grueling, and you put a lot of hours into it. Luckily, I have an extremely supportive family and the best and most supportive wife in the world. So a typical day for me, so I have 2 daughters, and so it usually starts about 6:40 with my daughter yelling at me that the sun is up. So I usually cook breakfast for my daughter, for my wife, and then I'm usually at the hospital by around 7:30. Well, I just had my other little girl 3 weeks ago. Yeah, so we delivered here at the hospital. I was actually able to deliver her. I work, as a family medicine resident, we work in the pediatric floor. We work on OBGYN. We work in labor and delivery, and we also work over in postpartum. So I feel completely supported. For example, say you need like a little bit of a break. Say your mental health is just kind of struggling. Those are things that our attendings are so keen and aware of, and they will take the time to be able to help you. So this is Minda, one of our medical assistants.
Hello.
We work with Lisa, Anna, and then Veronica, and they take really good care of us. If it wasn't for them, we wouldn't accomplish anything during the day. So we love them.
Thank you, Dr. Wilkey. We love working with you guys. You guys are awesome.
Oh, they take good care of us.
Thank you.
Okay, so precepting, that's where we basically,
You're saying, okay.
go do an encounter with the patient, gather all the information, and then we come back and we discuss the case with the attending. And usually it consists of giving the history, making sure we kind of describe a physical exam that we did in the room, and then we try to, develop a plan before we talk to the attending, and then the attending just teaches us whether, our thought process is correct, if there's things we want to change, add, and that's kind of where all the learning happens, is with the attending. Yeah, anything else, Dr. Wagner, with precepting?
I think that's a great summary. Clark here is such a sponge, just hungry for knowledge.
Yeah, put that in. My biggest piece of advice for anybody that wants to do residency here would be, come with a positive attitude, with a desire to learn, and with a love for family medicine. And so what we look for is for somebody that wants to take care of people and wants to take care of this community. Right when I started to help others, that's when I realized, this is where I'm supposed to be. I served an LDS mission in Chile, and then after that mission, I went and studied Spanish as well at the university at my undergraduate. And so I'd say 50% of my patients are Spanish speakers. And another reason why I love Southern California and Ventura. Bueno, mi nombre es Dr. Wilkey, soy residente de medicina aquí en Ventura. Y si usted tiene como deseos o ganas de aprender o hablar español, por favor venga aquí. Nosotros necesitamos residentes y personas que tienen mucha pasión para ayudar a los hispanos y latinos aquí en nuestra comunidad. Entonces, si habla español, venga, por favor, a nuestra programa de residencia.